RadPath. Tissue is the issue.
Williams case.
This is a female patient coming in with symptomatic shoulder pain, and you can see on the chest x-ray a outpouching of bone. Um, Ultimately, they excised it and they actually used a hammer and chisel. And you can see the gross photos right there on the left. And finally, the post-procedure x-ray shows the mass removed.
So
Osteochondroma. Tissue is the issue.
Taylor. This is a 70-year-old female with a pulmonary nodule, the right middle lobe, which has been increasing in size slowly. So we're thinking either hamartoma or carcinoid. Tissue's the issue. Taylor went to the surgery.
Yeah, so this was a really cool case. It was my first VAS procedure, and we placed the patient in left lateral, did an intercostal approach, and then did a middle lobe lobectomy. Final path for this was a typical carcinoid tumor.
Here's an interesting thyroid patient on a younger patient. We're following up the right side, which has some abnormalities. Let's look at the normal left side first. Nice and homogeneous echotexture. But when we get to the right lobe, you see the whole thing is replaced by this almost 7 centimeter nodule. There's some cystic spaces, some calcifications, which may be colloid. It's not microcalyx, I'm not that worried, but this is someone that had a biopsy before that came back lymphocytic thyroiditis. It's getting a little bit bigger. Worried about neoplasm, so goes for a thyroidectomy.
Follicular adenoma. Tissue is the issue.
One of our students got to watch a craniotomy. This is a 37-year-old patient with new seizure, gets an MRI. Let's look at the sequences first. So we have the ventricles are dark, so this is T1. This is T1 without contrast. The ventricles are dark here, so you might think it's a T1, but note it's a little bit bright around the ventricles, and then this mass is going to be hyperintense, and this is also on T2. So this is our flare image where the water signal is negated, but note we have this infiltrative mass in the left frontal lobe. It is bright on T2/flare, and interestingly, just a little bit of enhancement. So this is going to be a differential case, every Hartman differential Mets lymphoma.
Or it could be a glioma. Tissue is the issue.